All right. This chapter 6 I mentioned to you, research validity. Very important concepts there, and there are four very important concepts for you to understand. One, probably the most of the four, the most important for you to understand. We talked about it a bit during the web meeting that we had last Saturday, but let's talk about it a lot more now. So we're going to discuss four types of validity, research validity. Uh, Conclusion validity or statistical validity, internal validity, construct validity, and external validity. So statistical conclusion, construct, internal validity, and external validity. They are cumulative. That is, each one is important, and they also interact. Now, statistical conclusion validity is basic. Uh, uh, Whenever you do a statistical analysis, specifically when you do a statistical test, you do what's called a hypothesis test. A hypothesis test can be anything as simple as a z-test or a t-test to something much more complex, like a multivariate analysis of variance or multiple regression, or even much more complex tests like structural equation modeling. But essentially, this answers the question, statistically, is it possible that my findings occurred just by chance? So given you have two groups, a control group, a placebo group, and an experimental group, and then you do find a change after your experiment between the two tests, then the question is, could this have changed? This change happened just by chance? If I randomly selected these two groups and saw this difference, could that have occurred? We usually try to set the probability of a chance occurrence at 5% or less. So anything less than 5%, we say no, pretty hard for this to have happened by chance. This is most likely due, or 95% probability, or greater, due to what you did. And that is essentially what a statistical conclusion is. The computer, the stats package, and what I use mostly is SPSS, tells you what the probability is that this finding occurred by chance. And many times it's very, very small probability of something happened by chance. I've seen things where there's so many decimal places to the right of the decimal point, or in other words, very, very tiny, that it even runs out of significant uh, uh, places in order to put the zeros. It's very, very, sometimes very, very small. Other times it's right on the border of 0.05. But that's where we try to set the probability of finding your findings, uh, your results, by chance only. So then we move on to construct validity. And that is the extent to which we can infer higher order constructs from the operations we use to represent them. Now, we talked about measurement constructs in the last chapter. For example, if you are looking at a construct, at trying to measure, say, depression. Depression is a complex construct, and under depression there are several factors which have to be taken into consideration. That's why in reading some of your measurement, the measurements that you propose using in your experiments, that I emphasize that you understand and operationalize the constructs, or else whatever you're measuring really doesn't make sense. So you've got to have construct validity. So constructs here, you can use them for research participants. For example, children, adults, individuals with sleep apnea, those are constructs. Of course, an independent variable, frustration, anxiety, room temperature, and coding, a dependent variable, and again, some of these are quite complex. Intelligence is a very complex construct. Memory is in fact a complex construct. It needs to be operationalized to a level of detail that almost makes it frivolous. Of course, reaction time, that's a lot simpler. Experimental settings, but all these are various constructs. A more complex construct, and I have here an example of self-esteem. Now, self-esteem is a complex construct. When you say self-esteem, we have an intuitive notion of, oh, that is, he has high self-esteem. She has high self-esteem. He's not feeling too well today. His self-esteem is down. But exactly what does that mean? Self-esteem interacts with other factors, including social skills, which is a complex construct in and of itself, self-appraisal, another complex construct, confidence, and self-worth. So self-esteem is a very complex construct, intersecting with other complex constructs that in turn have factors that contribute to them. So construct validity is not to be taken lightly. And when you consider measurement variables, you have to consider the constructs that contribute to their idea. The thing about intuition is that it simplifies a notion, but then it occludes the constructs underlying the notion. So we need to move away that shade of occlusion and get to what the actual underlying constructs are. Some of the threats to construct validity, I'm not going to go through all of these, but construct confounding, the second item there, is a important one. And I've sort of harped on this idea of mono-operation bias and mono-method bias, and that is that these mono-operation and mono-method biases is that this idea only contributes to one thing and one thing only, and that is usually some sort of an intuitive notion of what that is, without getting at any of the underlying contributing factors that are that, in fact, that construct. So some of the threats to construct validity are, of course, participant reactivity to the experimental situation. People react to experimental situations. So we need to be very careful in participant reactions. Even when somebody is taking a test, I don't mean an academic test, of course, I mean some sort of a test asking them performance questions or personal questions. Even if they're anonymous, there's a self-reactivity going on. There is a self-awareness and a self-evaluation as we answer those questions. I run into that a lot, specifically when there's any kind of defensiveness involved in the responses to the assessment. For example, drinking behavior. The more somebody is close to being assessed as having substance abuse problems, for example, alcoholism, that individual becomes very sensitive to the questions. Even if it's anonymous, they still become sensitive to the questions, because if they answer them truthfully, then there's a certain amount of self-awareness in which they have to engage. So be aware of participant reactivity to an experimental situation. Now, of course, we remove some of this reactivity when we use control groups. Control groups are very important in any experimental situation. Remember, the three factors that are most important, there are others, but the three factors most important to having any experiment are random selection and assignment, number one, pre-test and a post-test, so two tests, number two, and third, a control group. The experimenter effect, as you may have already concluded, is also a very important threat to construct validity. And most of that comes from self-fulfilling prophecy. We behave as experimenters like any other individual. You want what you want to work. So many times we have to remove ourselves from the experiment. It's often unwise, and if you expect to get your material published in a respectable peer-reviewed journal, the editors will, in reading your manuscript, will say, well, if you were involved in the experiment yourself, if you were involved in either administering the tests or evaluating the results, I don't mean statistically, I mean evaluating as far as if there's any kind of a subjective methodology associated with establishing the results, you may be in trouble because your personal biases are then injected into the results unconsciously, out of your awareness. So what are some of the other ways that experimenters may bias the study? Well, of course, your attributes. And here, these categories of attributes contribute to the bias and the reactivity in the experimental situation. Biosocial attributes, age, gender, race, religion, those certainly will contribute to it, not only in your own assessment or appraisal of what's going on, but also in the reaction between you, the experimenter, and the participant. So now you have an interaction in participant and experimenter. It makes it even more complex. Then there are psychosocial attributes, including the experimenter's anxiety level, need for social support, hostility, impatience, things like that. Then there's situational factors, like maybe there's been prior contact between the experimenter and the participant. So as it says here, and I invite you all to Google and look up Hans the horse, because at this time, Hans the horse, people actually believed that a horse could really do math, but the experimenter, and in this case the trainer, interaction with the horse was very subtle, and indeed the experimenter himself may not have even known the effect that he was having on the horse, but the horse was keen enough to look at the expressions and behavior of the experimenter each time so as to know what the answer was. But in this case, please look up Hans the horse, biasing experimenter effects attributable to the researcher's expectations about the outcome of the experiment. So what does that mean? That the experimenter acts differently toward experimental versus control group to influence the study to support their hypothesis. Again, many times, most of the time, this is an unconscious, out of awareness process, but it exists, and it exists almost all the time. So be very, very aware of that. If you are with a control group versus an experimental group, you will have an effect on that, and that effect in and of itself will bias the results. Hans the horse so actually couldn't do math. He was just really good at sensing his trainer's expectations, and people observing this had no a sense of what was going on. Okay, now let's talk about internal validity. Internal validity is your ability to say with some credibility that what you did, the experimental effect, the independent variable, did indeed cause the change in the dependent variable. So a program or your experiment or whatever you do causes observations. In other words, what you see, the independent variable causes changes in the dependent variable. But as you can see on this graph, this diagram I have up here, there can be alternative causes that you may not be aware of. Those alternative causes, if you are unaware of them, are called confounds. They are extraneous variables that we need to control because they create what we call rival hypotheses. In other words, an action that can cause the same thing, or at least affect the same observations as your independent variable. We cannot have another plausible explanation for the effect. If you have to remove all the other plausible explanations for the effect. And I like somebody used the word bulletproof. This doesn't really make the experiment bulletproof, but we want to make it as bulletproof as possible. So internal validity, removing confounding variables, that is the effect, but any other effects that were between the independent variable and the dependent variable, which can come from outside, they can even come from inside. Extraneous variables. I've got an example here where the independent variable is tutoring and the dependent variable is grades. So what we would expect is that additional tutoring will cause an increase in grades. So in this particular case, we don't use random assignment, but use two intact classrooms to serve as experimental and control groups. Now, of course, random assignment would mean combining the intact classrooms, the two intact classrooms into one, then randomly assigning all of the students to one of two classrooms. But in this case, they used intact classrooms. So the groups are not equivalent. They are not randomly assigned. The experimental group, who receives the extra tutoring, shows significant improvements in grades. The class serving as your experimental group is an honors class, and this is a confounding extraneous variable. Understand these factors toward as threats to internal validity, and understand them. The names may be, the titles may be a little misleading, but we're going to go through what they all mean. History, testing, instrumentation, selection, statistical regression, experimental mortality, and maturation. What is history? History not in the terms of when did George Washington cross the Potomac type history, but history in the sense of your experiment. Anything that occurs between the pretest and the post-test. What is your subject, or what are your subjects doing in time that could in fact affect the outcome? Now, this is typically controlled for with a comparison control group so that the effects cancel out. But if you have differential histories where one group is doing one thing and one group is doing something else, they can have a significant effect. You need to know anything that is done between pre-test and post-test that can affect your results. A prime example would be if you're testing for some sort of mood alteration procedure, a treatment, or a drug, and between pre-test and post-test, your subject or subjects participate in a party or some other activity where recreational drugs are used that significantly alter their moods, and then subsequently come to you for post-test. So their use of recreational drugs was a confound. It affects the primary dependent variable, that is the treatment, to affect mood. There's something else that could affect mood as well. That is a rival hypothesis. So in this case, And this is a more subtle, by the way, this is a more subtle example of history and the effect. And this is something that we have little control over except when you use a control group as well. So in this case, the effect in both cases would cancel out. But in this case, a few years ago, if you'll remember, there was an actress, Catherine Zeta-Jones, announced that she's bipolar and wants everyone also suffering with it to know the treatment is key. Now, in this example, the researcher is testing a new treatment for bipolar disorder in a group of patients, and all patients seem to be showing improvement after 4 weeks. Can the researcher conclude that the new treatment is responsible for the improvement in the patients? Remember also, or you may not remember, but you should know that bipolar disorder is probably one of the most pernicious disorders to treat relative to med management. It's straightforward to treat, but patients also often discontinue using their meds because of the cycle going from low to high. So just that simple announcement, just news in and of itself, can change treatment effects. I remember I was monitoring member mood history for an insurance company I was doing outcomes analysis for, and this was in a period from 2006 to 2010 or 11. And during that period of time, of course, we had the market crash and the recession, the Great Recession, and I saw in that period of time considerable mood reduction, depression in that period of time, and I also saw far less change between pre-test and post-test in depression. So that in and of itself, just environmental circumstances, should be included as a confound, that is, history. The next is maturation, which is the process of growing older, growing stronger, or even growing tired or impatient or fatigued. So maturation is any natural change that occurs just from doing something or from living. It's any physical or mental change that occurs with the passage of time and can affect the dependent variable scores: age, learning, fatigue, boredom, hunger, anything. Instrumentation. Now, this is something that I believe I also addressed with some of the measures, and I know that some people are working with biometric type instrumentation, EEG and EKG. Excellent choice in assessment procedures. However, we need to be very aware of what instrumentation does. It can change from pre-test to post-test, and in fact, you can even go into it with unreliable instrumentation. Not only could the instrumentation be unreliable, but the human observers also can be unreliable in measuring the instrumentation or in conducting the procedures necessary in order to make the measurement. So one has to be very careful about how not only how the procedures are implemented using instrumentation. I'm talking not only about physical electronic instrumentation or biomedical instrumentation, but also psychological, psychosocial instrumentation as well. So any kind of instrumentation, one must make certain that the measure, the instrument itself, whether it's biomedical or psychosocial, is reliable and valid. A simple example of instrumentation would be a speedometer. If your speedometer is inaccurate but reliable, that means, say, that it always shows that you're driving 65 when in fact you're driving 75. So you get pulled over and the officer says, I clocked you at 75, and you say, no, sir, my speedometer sits 65, you're going to get a ticket. You take that to a speedometer metrology lab, and they say, yeah, it's off by 10 miles per hour. Your speedometer was very reliable. It always showed that you were going 10 miles an hour slower than what you really were going. So that's very reliable. Now, in fact, if you had gone into, if you drive your car and the speedometer is all over the place, and sometimes you're going 65 and sometimes it shows 85 and sometimes 55, when you're in fact driving the same speed, then you've got not only an unreliable speedometer, you've also got an invalid speedometer as well. Instrumentation is the same way. This is why we cannot create our own instruments. You can't just make up some questions and then ask somebody, because you don't know the level to which those questions will produce valid and reliable responses. Stick with the gold standard measures that have been tested and replicated in other studies. Other reliable studies, remember now, other reliable studies, not just one study where the researcher you made up a questionnaire and you like that researcher and you like that questionnaire and it hits exactly what you want. Just because it hits your sweet spot for research doesn't necessarily mean that it's a good instrument. So make sure that your instrumentation is reliable and valid. Then there's testing. In a way, testing is sort of like maturation. In that we have a pre-test and then you do the intervention and then you do a post-test. Now, whenever you give somebody a pre-test and then you give the same test again later, there's a testing interaction. They've had the test before, and there's this process of this change toward the test. Again, using a control group cancels out these issues. Often we do more than two tests. We do what's called repeated measures designs, where we do subsequent testing, maybe a test every week or a test every other week. Sometimes, especially with psychosocial tests, the testing threat is greater than with a biomedical test. For example, what's the reaction with having your blood pressure tested every week versus what is the reaction to taking a Beck depression inventory every week? One thing is that the biomedical test, you remain somewhat passive. You sit there and you take it, but still you're thinking, and even your thoughts can intrude on your blood pressure. When you take something like a Beck depression inventory, you're thinking about the questions, and one of the questions is I'm sad or I'm not sad, and you have to think to yourself, well, how do I feel today? How am I right now? This in and of itself, in going from time 1 to time 2 and taking multiple iterations for the same test, is a threat to internal validity. Again, most of the time, this is canceled out with the control group. Another threat to internal validity is called statistical regression to the mean or regression artifact. If you choose individuals who are at an extreme of a measure, test them at test 1 and then test them at test 2, even if you don't provide a treatment, there will statistically be an improvement because they've started out at an extreme. Now, again, one thing that gets rid of this problem, of course, is random assignment. You may, in fact, have extreme individuals on whatever the measure is you're testing, and it may be an extreme high and an extreme low, but you will have some extremes, unless, of course, you control for those or exclude them. For example, I'm sure you've seen research queries go out looking for clinical research participants and for depression, and if you go in, you'll find that some of the exclusion criteria are that you have not had, let's say, a major depressive episode before. This is your first and the only major depressive episode you've ever had. There's also age exclusions, other types of exclusions as well. So there's certainly exclusions, but let's say that you don't have exclusions. Then when you have your research participants, again, one of the first things that the major inoculation against regression artifact is random assignment. That way you're getting them in both groups. So again, the effects cancel out. And like it says there in the last item, they're typically, this could be controlled for with a comparison control group. Then we have what's called mortality, which isn't really people dying, it's attrition. I mean, in some cases, yes, it can be dying, but most of the time we just call it attrition. In other words, people drop out of the study. Loss of participants. Now, obviously, this is problematic when participants are tested multiple times. So you do, and of course, they're tested multiple times in a real experiment where you have a pre-test and a post-test. So now the issue is, the question you have to ask yourself is, what is different about people who stay in the study versus people who drop out of the study? And again, a lot of this can be controlled by using a control group. So they cancel one another out. But even at that, let's say that you have more participants dropping out of the experimental group than out of the control group. Then you have to ask yourself, what is the difference between that? Now that in itself can open up vistas to another study, and that is, why do people not stay in certain studies? The example I have here is a multi-group design where people are being tested in a new exercise program. So the independent variable is the new exercise program, and the dependent variable is weight loss. So differential attrition, or in other words, mortality, is more participants drop out of the experimental group because they are unmotivated to exercise. So we would have to have in the control group some sort of an exercise that is not the same as our new exercise program. We would have to have maybe some more conventional type of exercise other than the new exercise program, but they would have to be treated in somewhat of a similar way. Otherwise, you do have to analyze what's the difference between the two. So to stay more on mortality and attrition, again, the threat of mortality or attrition regards the possibility participants may drop out of a study for some systematic reason, and that's what you have to be careful about. Not a random reason, systematic reason, because systematic reasons create bias, systematic bias, and that systematic bias can severely confound your study. Where it's a random bias, where it's not really a bias, but where it's random, you've got it in both groups. So it doesn't pose a problem because they both cancel out. Okay. Selection, randomness, is the, and this is shown last, but in fact it is your number one defense against threats to internal validity, randomness. Random selection is very difficult in many cases to achieve. Random assignment, much simpler to achieve if indeed you are completely random in your assignment. Random assignment should never be done personally. It needs to be done through a method of algorithmic assignment. And in fact, I thought I had it on here. There are internet systems, randomizer.org, that you can put in the number of groups you've got and the number of people per groups. I mean, groups that you want and the number of people per groups that you want and the number that you're starting with and so on. And it will assign. So let's say that you have each participant numbered. So 1, 2, 3, 4, 5, 6, and so on. And then it'll tell you group 1 contains participant 1, 5, 8, 12, and so on and it'll completely randomize your group assignments depending upon the number of groups that you've got. Selection, production of non-equivalent groups because of a different selection procedure operates across groups. You've got to have the same type of randomizing procedure. And of course, whenever you don't use random assignment in a multi-group design, for example, the tutoring example that I mentioned at the start of this, this can be a very confounding variable. Okay, remember I promised you 4 factors of research validity. Remember, there's statistical validity, construct validity, internal validity, and the last is external validity. Now, external validity is sort of the flip coin of internal validity. With internal validity, consider your internal validity like a lab situation, and you're controlling as much as you can inside the lab. In this graphic I've got here, inside the green oval, that's internal validity. Was the research done right? Can, in fact, within this setting, within that oval, can I say that indeed the internal validity, the independent variable had the effect on the dependent variable? So how could that possibly go wrong? Well, that's fine, except people don't exist inside this control setting. Animals don't exist, people don't exist, things don't, they are outside in the environment, in the external world. So external validity asks the question, does the same thing happen in other settings, in other labs, in other places, in other times, with other people, with other researchers? So external validity is the degree to which, pardon me for reading this, but I think it gets the point, right? The degree to which the study results can be generalized to and across other people, settings, treatments, outcomes, and times. And again, there is somewhat of an inverse relationship between internal validity and external validity. So a failure to generalize can result from several factors. A failure to take where the internal validity, the results on the inside, don't work on the outside. What could cause that? Well, lack of random selection, not assignment, selection. Selection is much harder to achieve, especially in large and diverse populations. Chance variation, again, we're always stuck with chance variation, and a failure to identify interactive effects of independent variables. We can identify other potential variables that interact from the outside and include those in the study as extra independent variables. So when we have conclusions relative to the outside, we have other times, other places, other settings, other people, not only other participants, but other researchers as well. These are fairly self-explanatory. Population validity, the degree to which the results can be generalized to and across people in a target population or in other populations. Ecological validity, the degree to which the results of a study can be generalized across settings or environmental situations. And that may include the weather. Do we find similar results in the summer versus in the winter? Do we find similar results if we do the same study in a tropic zone versus an Arctic zone? Time, temporal validity, the degree to which the results can be generalized across time. And there's some interesting historical psychologists who even look at the external validity relative to constructs. For example, personality. 1,000 years ago, could we assess personality in the same way that we assess it today? So that is a severe type of external validity relative to time. Degree to which results can be generalized across time. Same with intelligence. People have tried to ascribe IQs to people, to historical figures. I remember that one of the highest IQs I ever saw to a historical figure was Goethe, who I think the people who ascribed his IQ was something like 190 or 200. So you have to figure out where does that come from based upon today's thinking. Voltaire also had a very high IQ, but then again, they didn't take any IQ tests, so how do we determine that? And what is the temporal validity associated with that construct? Treatment variation validity, the degree to which the results of a study can be generalized across variations in the treatment. And that would include even medication, variations in the treatment relative to medication. Here's an example. A clinical treatment during research studies are typically given by seasoned, competent therapists. So the results of the study may not generalize to treatment of the general public. So whenever we do a study, we have, let's say we're doing a study with anxiety, and that anxiety is being treated by tried and true behavioral techniques by individuals, let's say 10 different therapists who have a lot of experience in doing graduated exposure, for example. And then we transfer that same study now, we transfer those techniques outside to therapists who do not have as much experience, but they have a manual in front of them. Now, this is one of the important issues with manualization, because without a manual, there'd be nothing. There'd be no way to provide inter-rater reliability. But just a lack of inter-rater reliability would suggest that there's therefore a lack of external validity. Outcome validity, the degree to which the results of a study can be generalized across different but related dependent variables. Let's say that instead of using the Beck Depression Inventory in depression outcomes, we use the Hamilton Depression Scale, or we use Scale 2 of the MMPI, which also measures depression. We may see how can we generalize those results across different outcome measures. And as you can see here, and I think this is the last slide for this presentation, the relationship between internal and external validity is somewhat of a tug of war. It doesn't have to be, though. You can include variables and measures in it that account for changes in external validity. But as you can see here, the relationship between internal and external validity is often inverse. Factors that increase our ability to establish cause and effect tend to decrease our ability to generalize. I would like to say here that the third item is the most important item. I should have put that on the top. External validity is established through replication. In other words, one study isn't enough, and that's why I beseech you to please find other studies relative to your research. One study in one journal, and look at just how well the journal is peer-reviewed. One study is not enough. You must have replication in order to infer external validity. I think that's it.